When the nurse receives an order for an IV push medication, she will verbalize the indication for the order. The nurse will then look up the medication's reference information to determine the contraindications, side effects, and dosage. She will also determine its compatibility with any medication that is in the existing IV line in which the medication may be pushed through. Once it has been determined that the medication is all right to be administered, the nurse will perform hand hygiene. As the medication is being prepared, the 5 rights to medication administration will be verified. These include right patient, right medication, right dose, right route, and the right time administered. The nurse will explain the purpose of the medication being administered and the potential side effects to the patient. She will explain how the medication will be administered as well. The nurse will identify the patient using 2 patient identifiers.
Can you please state your full name and your date of birth?
My name is John Smith. I was born July 7th, 1985.
All right, Mr. Smith. The last nurse said that you were experiencing pain. Can you tell me where that pain is located?
At this point, the nurse will complete the other 5 rights to medication administration. These include right to patient education, right documentation, right to refuse, right assessment, and right evaluation. After applying gloves, the nurse will assess the patient and monitor the IV site for redness, edema, and dislodgement. She will then clean the injection port closest to the patient with an alcohol swab. If the IV is a peripheral IV, she will clean it once for 15 seconds. If it is a central line, she will clean it 3 times for 30 seconds each time. For a running IV infusion, the nurse will clamp off the existing IV line. She will attach a 10 cc saline flush, aspirate for blood to make sure the needle is in the vein, then proceed with the saline administration. As she is gently pushing saline into the catheter, she will monitor the patient's response. Once complete, she will remove the syringe. If there is no blood return when aspirating, or if there is difficulty injecting the saline, the nurse will need to discontinue the peripheral site. For a saline-locked IV, the nurse will unclamp the saline lock and do the same procedure as with a running IV infusion. Either with a saline lock or with a running IV infusion, as long as there were no complications with the flush, the nurse will then attach the medication syringe to the IV port and administer the medication at the identified rate. The nurse will monitor the patient's response to the medication while administering. Once administration of the medication is complete, the nurse will disconnect the medication syringe and attach another 10 cc saline syringe to do another saline flush. She will be monitoring the patient's response to this as well and note the flow of the saline. Once complete, the nurse will dispose of all the syringes, remove her gloves, and perform hand hygiene. The nurse will monitor the patient's response to the medication. Finally, the nurse will then accurately record the medication administration on the MAR.